afternoon, everybody. I'm super excited to have an opportunity to once again bring you some capacity building opportunities, to introduce you to some of our friends from across the country who are what we like to call subject matter experts. Again, my name is Toni Young. I'm the founder and executive director of Community Education Group. And we are super excited to introduce my good friend. Well, maybe we're not such good friends, but we're about to be good friends. Melissa Curry. Is it Dr. Melissa Curry?
It's Melissa Curry.
Okay, not doctor though. Is it doctor?
No, not yet.
All right. So, Melissa, will you introduce yourself to all of the people that are going to watch this video?
Yes. So hello, everyone. My name is Melissa Curry. As Toni stated, I am the Director of Clinical Services at Abounding Prosperity. I'm a nurse in background. I have experience as project director, researcher, business analyst, you name it. And so I'm excited to kind of share our perspective at Abounding Prosperity in regards to HIV self-testing, building coalitions, and community partners.
Perfect. I know it's a lot of stuff like home test kits, partnership development, community development. I basically threw the kitchen sink at you, but we're going to try and get some information from you because, again, you're a subject matter expert, or that's what the people on the street say. So first of all, let's tell people about Abounding Prosperity. And before we start further than that, I want to send out my love to my AP family with the passing of a good friend of mine, Kurt. We fought like dogs, but he was one of the probably most inspirational leaders that we will see in our time. So I know that the team at AP is still mourning, but I'm thanking you for taking the time out to do this with us.
Yes, thank you so much.
So tell me about AP.
Yes, so Abounding Prosperity is a community-based organization located in Dallas, Texas. We have been, our founder, Mr. Kirk Myers-Hill, the late great Mr. Kirk Myers-Hill, founded Abounding Prosperity well over 15 years ago. And it started out as just HIV testing, and then expanded to STI testing, and then it just blew up. And we've been developing so many different services. We do HIV testing and treatment, STI testing and treatment. We offer HIV prevention services like PrEP. We do community outreach. We have a plethora of programs. We have a program called The Spot, which is like a youth drop-in space. We have a wellness program. We have our transparency program, which is specifically catered to our transgender women. And so overall, Abounding Prosperity has a strong focus in the Black community with a strong focus on MSM and its family and their families, as well as transgender women, cisgender women, and their families as well.
Yeah, thank you so much for that. I think that many people think about programs like AP and they think, oh, that's a program for Black gay men. And sometimes it's just because of who ran the program, right? But, I was fortunate enough to be at the groundbreaking for the park that Kurt dedicated to his mother. And, during that talk, one of the things that Kurt talked about was that AP is about the Black family and about family. And I think that that's one of the things that is so critically important in the work that we do. It is not just about one particular population. It is about the families that we are a part of, the families that we create, and the families that we frankly need to nurture. Now, a bit of what we are doing is that we've been funded through the Centers for Disease Control Foundation. We're working with over 50 community serving organizations across the United States, but we are particularly working with them to distribute home test kits for HIV. Does AP do any work like that?
Oh, yes, actually, we are very well known for our HIV self-testing program. And just to elaborate on that, it really got strong during COVID when a lot of organizations had to shut down because of COVID. But AP is constantly strategic and forward thinking. And so with that, our home self-test kits allowed us to continue our PrEP program. Also, we have an HIV care bridge program where we do rapid start, and we start patients on rapid ART medications. And then once patients are virally suppressed, then we bridge them to long-term HIV care providers. And so that just allowed us to sustain our program just by being innovative, offering telemedicine and having our telemedicine program integrated and interfaced with our electronic health record.
So, all right. So it sounds like y'all are doing the thing. And so, I mean, that sounds great. You know, a lot of the organizations, not all of them, but a lot of those 50 organizations that I mentioned to you are smaller organizations, probably by comparison to AP. But so I want to go back to this, what you guys are doing in the home test kit space, right? So does that require, how did you start? If you know that, how did you start that? How do you sustain that? Because I mean, those home test kits are expensive. And so how do you sustain that? How do you have, who are your partners in that? Tell me about that a bit. I'll let you talk.
Okay, so I think it's important to notate that to sustain any type of program, you have to start sustainability planning from the very beginning. And so when we would submit for funding, we would incorporate HIV home self-testing in our grant proposal so that, you know, funders already knew that this is something that we were going to do, and we would integrate it in whatever the key goals were for the actual grant.
So you mean, I'm sorry to interrupt, but everybody who know me already knows what I do. So now you know too. So let me ask, so I think what you're saying, so people who are watching this or getting ideas from this may understand that what you're saying is that this is a part of your sustainability plan for being able to continue to do home test kits, because that's one of the things that's happening, is that this CDC Foundation grant for many of these organizations is ending. So what we want to be able to do is give them some tools of how to think about this different, how to fund this differently. So what you're saying is that you might be applying for a grant from, you know, I don't know, the Icada Foundation, and the Icada Foundation grant might be an HIV grant, but you include a component of it that will cover the cost of home test kits.
Yes.
Okay.
Yes. And so as long as you're meeting the key core curriculum of what's required for the grant, but you're attaching that to the intervention of HIV self-testing, you know, funders look at that and they look at it as progressive thinking and forward thinking. And so then you can budget for that within your grant proposal. Other avenues that can be utilized for sustainability are, if you have 340B funding, you know, utilizing that.
Whoa. What's this 340B thing? Oh, what are you talking about? I told you these are small community-based organizations. Hey, so tell the people, don't tell me. If you bring it up, you got to talk about it, because that's how you gonna talk about it. You got to be about it. So tell the people what 340B programs are. In a nutshell, not the whole, you don't have to cite the federal, but just tell them what it is so they'll get it.
Yes, 340B is a program that's overseen by HRSA and
the Health Resources Services Administration, which also administers Ryan White. Sorry to talk over you. I apologize.
That's okay. That's okay. I know I can talk and use a lot of acronyms, so I apologize for that. But yeah, so it's overseen by HRSA and specific community-based organizations and medical clinics that offer specific types of services. One of them is HIV care, and then also certain states might allow for like STI services and PrEP, which is HIV prevention. And so essentially it allows the covered entity, which is the organization, to purchase pharmacy medications at a lower rate And so essentially allowing for reimbursement from the insurance companies to have what's called 340B access dollars. And so you use that profit to be vested back into your organization to provide more services to your patients.
Now, you can't get a 340B reimbursement for a home test kit though, right?
No, but you can use like your funding. You can use your 340B funding to like cover the cost of labs, to purchase, the actual HIV self-test kits. Some insurance companies do allow for that you're able to submit a claim to the insurance company and they will cover the costs of the HIV self-test kit, but they're kind of limited.
Mm-hmm. So, and I think that, most people that I know, or most organizations that I know, I got to tell you, I know that 340B, some companies now are pushing back because of the reimbursements, they don't want to pay them anymore, that kind of thing. I think that many organizations that have a clinical component, certainly, meaning they have a clinic inside or a clinical look-alike, that kind of thing, are more structured for 340B. So every organization isn't necessarily going to be ready. And I think kind of at this point, you might have missed the 340B boat, but that's just me, hypothetically speaking. I mean, I think you still could apply for it, but I don't know. It's a lot of work. And I think that people made it sound like easy money, but it's not. It's a lot of work. It's a lot of paperwork, yes, and that kind of thing. Now, what I want to talk to you about too is because you said clinical director, right? Clinical director.
Yes.
Right. So if you're the clinical director and getting patients in or getting clients in to AP, what are the kind of partnerships that you need to develop throughout Dallas, throughout the country, in order to make that system work?
Yes, with that being said, one of the major barriers, we identify barriers. So we do like a needs assessment, and then we have local needs assessments, and we determine what are the biggest needs in our area. And one of those is definitely transportation. We are based in a very marginalized community with very limited resources. And so understanding that, we had to be creative. And one of those is we partner with Uber Health. And so patients that have issues with getting to their medical appointments, we are able to utilize, some of our funding, depending on which grant, to offer transportation to and from their medical appointments. So we had to partner with transportation services. We had to partner with housing because housing is a major reason for a patient not coming to their appointments. So if a patient is not housed, are they going to take their medication every day? Are they going to sustain that? So understanding that there's underlying social determinants of health. Thank you.
I knew what you were reaching for. I just wasn't sure if I was in the same bag as you.
So you have to make sure that you are reaching that. And so partnering with the housing, specific housing organizations, we have housed with food partners, so like the local food banks, to make sure that we are able to offer our patients, resources for food and just overall hygiene. Other medical clinics, right, that offer services that we may not offer. For instance, like I said, we do the bridge care program. So we're able to, get our patients virally suppressed, and then we're able to get them connected with a community partner that offers long-term HIV care. You had mentioned about some barriers that occurred with some of our partnerships. And even though we have MOUs, data use agreements or what have you, one issue was that when we were bridging some of our patients to, particular organizations, they wouldn't get in care immediately because they had to complete ADAP paperwork, and that was a whole process.
It's the AIDS Drug Assistance Program, right? So that's how you get your medication. It be after. I think that because now they keep saying put people on Medicaid because Ryan White is supposed to be payer of last resort. So it's all. There was some kerfuffle, especially in Texas, where
Yes.
you are, there's a big kerfuffle about who owed what to whom, particularly after COVID. So that's for y'all, that's down in the weeds for y'all seeing this about kind of what happened there. But go ahead, sorry.
No, that's okay. Yeah. So with that being said, it was taking time for our patients to get into care, into long-term HIV care. And so we had to kind of navigate that. So we developed like an intensive care program where we are able to, like our linkage to care coordinator actually does the follow-up, schedules the appointments with the patients, follows up with the patient to make sure that they met with the provider and making sure that they have a close relationship with the case managers at the organization that we're bridging the patient to ensure there's communication, to ensure that the patients are taking their medications. We also do ARTIS, which is a strength-based case management model where we identify the strengths of the patient. It's actually like a CDC intervention for those that maybe are disengaged in care or lost to care. And so all of our case managers are artist trained, and you can get trained right on, the CDC trained website or what have you. And the artist is ARTAS. So beyond that, since they're strength-based trained, they're able to understand what the barriers are or what the patient is at risk for and what their needs are from the very beginning, to kind of see how they can work with the patient to allow them to be self-advocates for themselves. And so, and we'll follow them as long, artists is up to 6 follow-ups, but typically between 3 to 5, we can basically ensure that a patient is re-engaged in care. I think also another important factor is with us, our staff, our organization mirrors the population that we serve. And so because of that, we can relate to our patients. It increases trust and allows for our patients to remain engaged because they know and they feel comfortable. We offer culturally responsive intersectional stigma prevention training to all of our staff. And it is a type of training to reduce stigma within the clinics. And so with that being said, we ensure that, the ambiance of the clinic, the resources that we offer patients are not stigmatizing, how the clinic looks, how we engage a patient. All of those things we have been, everyone has been trained on so that, we're able to engage patients better and reduce stigma.
So here's one question for you. So let's say I am a person who wants a home test kit from you. What do I do how do I get one at AP?
So you can just call the clinic. You contact our clinic or you can send a message through if you're an established patient, we have a portal through our electronic health record that you can send a message to, or you contact the clinic, or you can go online to our website. You just contact us, let us know that, this is what you're interested in, and we can set you up and get you a kit shipped out. We also offer molecular testing, which is a different type of HIV self-testing kit. It's a blood spot test. And so it's shipped out to the patient's home. The patient can also do STI testing along with the self-testing kit. They can get it FedEx shipped directly back to the lab. And this is something that we have covered under our one of our grants. And so we're able to offer this service to patients, and then they're able to either get on PrEP if they're interested, and then also come in if there's a positive test or reaction. We actually walk the patient through it. Our testers meet with the patient virtually to do a telehealth a televisit, should I say, because we don't call these particular visits a telehealth visit, because that's more for the medical provider, but the televisits, they can meet with the patient and kind of walk them through how to do the test, and then also follow up with them once we receive the test so that we can give them their results virtually as well.
Perfect. So, all right. So here's what we're learning today. Here's what we've learned today, because we're supposed to talk about home test kits. And what we learned is a couple of things. One is that AP has a mechanism where I can just kind of email in through my electronic health record. So for your organizations out there that have an electronic health record system, you could do it as an add-on or some sort of plug-in. I think that would be great, and probably can reach out to AP for a little TA on what they've done and how they did that. I'm putting you on the spot for that. I don't know who will call you or who may not call you, but all your information will be somewhere and you might get a couple of emails. All right. So one thing is that we know you can do that. The other thing is that it sounds like, if you're out in the field and doing a testing event, can I say, I don't want a test here, but can you mail me a test?
Yes, we can definitely mail tests. We can offer a home test that the patient can take home with them for an addition. Let's say they get tested out in the field, but they want something because maybe they don't usually attend an event, sort of like for instance, Juneteenth. We can offer them a home self-test kit that they can take home to take at a later date as well.
Okay, so we can do that. You're saying that you also provide take home kits during community events like Juneteenth, health fairs, that sort of thing. So you can have that. You say that in order to really kind of make this work, you need a myriad of partners. You need local partners, you need other kind of health partners, but you also need food banks and others that are probably another touch point for that individual. And that's to promote your program, but also maybe to do events with those other touch points in the community. The other thing that you've said to us that is a critical takeaway is that you need people along the continuum of care for the individual, meaning that if an individual can't make a medical appointment, doesn't matter if they've been screened or not screened. Doesn't matter if they got that home test kit or not. If they can't get into the facility to see a physician or a PA or a nurse practitioner or whomever, if they can't get in for their medical appointment for follow-up, then the whole gig is up. So the reality is that you also have a partnership with an organization you mentioned, Uber Health. And what we're going to do is put up on the screen Uber Health's website, because I think what a lot of people don't understand is that Uber Health gives you a discount on rides for folks coming in for clinical appointments. Again, another critical partner to reduce costs on that sustainability piece. And I think sometimes they'll even give them to you for free, depending on the volume that you're getting them in. So it's a great partnership to have is with somebody like Uber Health. I think there's also other programs like with Amazon Pharmacy, et cetera, as they're trying to move into these different marketplaces. What I want to do is certainly kind of thank you, because what you've also talked to us about is the sustainability piece of this, is that you've got to, I think that many people look at organizations like AP or like CEG and they're like, oh, well, they've got it all together. Well, the reality is that you, me, and everybody else is putting it together with a little piece of gum, sticking it over here and putting it together there. But, I think that there was certainly the vision of Kirk to have this clinic. I think it was certainly the vision of him to have it in community. And I think it was also the vision of him to have it maintained and sustained by community. I think that's one of the most important pieces of this, is that folks I think often that people will not test with people from their community, that people don't want to get their result from people in community, meaning people I may or may not know or went to high school with. I disagree. I think it's the opposite. I think that there's a piece of trust that happens within community, particularly the communities that we come from, that we were raised in, that is a different level of understanding. So I want to certainly say thank you for taking time out to chat with us about kind of sustainability, about who the partners should be, about your home test kitting program, and about the services at AP. And I think the organizations that will take a look at this hopefully will be able to see themselves, if not today, what they can grow into, like an organization like AP. Everybody doesn't have a charismatic leader like Kirk, but I think that if everybody puts their nose to the grind, we might have a chance to eliminate HIV, particularly in the African-American community, and particularly using new tools and new technology like home test kits. Is there anything that you'd like to say as a closeout?
Yes, I think what makes Abounding Prosperity so successful is ability we have an approach called see the need, be the need, and fill the need. And with that being said, when we see a need and there's a gap in that service or that area, then we become the need. And by becoming the need, it enables us to fill the need. And so I think that's what really, really makes us stand out, is that ability. And so for those that are trying to figure things out, you just find the hole, you find the gap, and you just become that need.
Thank you so much. And I think sometimes you have to fill that gap when you don't necessarily have the money. You just do it because there's a need. And I think sometimes that's that, I think that's the other piece of it. As the CDC Foundation grants come to the end. I think some of it is going to be, if this has been working, if home test kits have been working in your community, let's work together to figure out how we talk to corporations like OraSure and others to be able to maybe give us a discount rate on the home test kits, but that we have to keep doing the work, and we may not necessarily have a grant for it right now, but there's such a huge need for communities to continue to test, particularly those in African-American communities across the United States. Ms. Curry, thank you so much again for taking time out of what I know is a troubled time, but also a busy time at your organization to share your knowledge and experience with me, as well as with the 50 plus community serving organizations on the CDC Foundation Home Test Kit effort. Thank you again so much, so very much.
Thank you. Thank you. Appreciate it.